Here we present our poster about cerebral ataxia with hypogonadism, clinical clues to help the neurologist to diagnose adult PMM2-CDG patients. We know that PMM2 is the most common type of CDG, and most of the major clinical features involve cerebral hypertrophy, hypotonia, strabismus, epilepsy, failure to stride, feeding difficulties, and developmental delay. And the children is notable for abnormal fat distribution with suprapubic or buttock fat pads and nipple inversion. In adults, these are not so common features, but in adults you can see some skeletal features in adult patients, a stable cerebral disease, and some very odd combination of short trunk with severe scoliosis, with long limbs like morphonoid habitus. And some patients, they still have an abnormal fat pads, but most of the patients did not show this feature anymore. Recurrent thrombosis, peripheral neuropathy, retinitis pigmentosa, stroke-like episodes can be the main manifestations and clinical issues in adult PMM2 patients. And most of those patients can be missed by the adult neurologist and the clinicians. So we believe that a combination of some features can help the neurologists and the adult clinicians to think about CDG in the adult population as the combination of cerebral ataxia and hypogonadism. You can see some of the features that can be present. So we want to present our clinical data about a screen that we did in patients looking for CDG adult patients in a selected population of patients combining cerebral ataxia and hypogonadism. We did a retrospective study looking for findings in brain MRI, neurophysiology, biochemical testing, and some did including muscle biopsy. So we found that most of the patients were referred because of cerebral ataxia, with very different ages of onset, most of them in their childhood. Optic atrophy and reticuloid degeneration were found in 5 patients, but none of them had a typical retinitis. Only one of those patients had, in fact, CDG1A, but she did not have any involvement of nerve optic or reticuloid degeneration. Cerebral atrophy response involvement was considered featured in 16 patients, including the patient with CDG1A, and we could find also coenzyme Q10 deficiency. So it's funny to see that most of these patients, this combination of cerebral ataxia and hypogonadism, they can have eye involvement, but it's different, the eye involvement in those patients compared to the patients with CDG1A that's more retinitis pigmentosa. Our patient had a cerebral atrophy that was screening for a lot of spinocerebellar ataxias of adult onset and for Friedreich ataxia, but her involvement is very different from Friedreich ataxia, and she had mild intellectual disability as well. This is our patient. You can see that she has some facial features that are reminding of the CDG, and including she has these long hands. So our study reinforces that cerebral ataxia with hypogonadism could be a good niche to look for CDG adult patients. Most of the patients with multisystemic CDG did not reach adulthood, but the patient with more attenuated phenotype that's not so innocuous, that because they can have intellectual disability, speech disorder, scoliosis, they cannot be diagnosed with CDG. And the hypogonadism could be mostly seen in female patients. So as the one that we found. And there are other studies showing that in adult CDG patients, hypogonadism can be an issue, but not seen a lot in the male patient, but most in the female patients. And the CDG biochemical screening can be near normal in some adult patients. Fortunately, in our patient, the MS studies, they could show the abnormal transferrin. And if you don't have many severe striking features, these CDG patients, these adult CDG patients can be not diagnosed until adulthood. And there are reports of even mild intellectual involvement or no intellectual disability at all. This is a case of a picture from a patient with CDG01A from Australia that she worked like a secretary, and she had only mild, very mild cognitive impairment. Thanks.